Okay, compartment syndrome is a totally different kettle of fish. Compartment syndrome we most commonly see in the anterior compartment of the shin. So this is a compartment. It's best to think of a compartment, it's a little bit like a piston that sits inside a cylinder. So we've got a closed fascial compartment, very fibrous, strong band of tissue, and the muscles, blood vessels, nerves sit within that closed fascial compartment. It means that if there is an injury to those structures and there is any sort of swelling or inflammation, they've got nowhere to go. And that is the essence of a compartment syndrome. So what can happen here is you can get a blow. For example, if you're playing soccer and somebody kicks you on this compartment, you get a bleed within the compartment. The blood wants to escape, but it's got nowhere to go because it's contained within the compartment. What this then does is it shuts down the blood supply, and we have a very serious sports medicine condition here. In fact, we regard it as a bit of a medical emergency, because if that happens, you will get muscle death. So it's a little bit like a myocardial infarct, a heart attack. The actual muscle tissue dies, and once it's dead, it never recovers, and you can end up with a profound drop foot as a result of that. So if we've got that condition, which is characterised, normally there will be a history of a blow, severe pain, doesn't go away with rest, often will keep the athlete up. They have to get to an emergency room basically, and you have to actually cut the fascia open to allow it to bulge out so that you can get some pressure relief. It sounds pretty gruesome, but that's the way it is dealt with. Now there are obviously minor variants of that. You can get an overload version of this where the muscle simply becomes swollen because it's being so overused. The same thing happens, it shuts down the blood supply. You get severe pain, you can get some numbness in the foot, and this usually, with runners, settles down once they stop running. But it's a very different presentation of shin pain. The main way this is identified is with what we call intracompartmental pressure testing. We put a catheter into the muscle and we measure the actual pressure within the muscle before and during and after exercise. So if it's elevated above a particular level, we know that we're dealing with the compartment syndrome, and that athlete probably will proceed to surgery to decompress the fascia. Okay, so a very, very different and quite serious presentation for shin pain. Now, so we wouldn't be talking about other methods of treatment for this. You can look at resting. Inevitably the condition will come back because it's a part of the personal makeup of that particular athlete.